My name is Marty Mascari. I'm with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center. Welcome you all today. We're thrilled to have Donnie Green here, who is my boss, to talk to us about services for residents leaving nursing facilities through our two organizations, the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center. But before we get started, we want to talk a little bit about the CEUs for those of you that are on looking for CEUs. If we could advance to the next slide, that would be great. Thank you. So those of you that are on looking for CEUs, we're set up to provide CEUs to licensed social workers and licensed professional counselors in the state of Texas. The certificate or a certificate of attendance, if you'd like, we're set up to provide 1 hour of CEUs or one CEU hour, classroom hour. In order to qualify, you must attend the entire webinar. You can't miss more than about 5 minutes of the webinar to qualify for the CEUs. You must also complete the Google survey, evaluation survey. That should pop up as you close out of the webinar today. It should automatically pop up. I realize some of you work for organizations that have those pop-ups blocked. And if you do, that's okay, because I'll also send out that survey link in the follow-up email that will go out sometime later today. That will have that, and it will also have the link to the slides and the handouts. You'll have 1 week to complete that survey. It'll be up until the 13th, and then you should have your certificate within the week following that by the 20th. I want to let you all know that I sent out in the reminder emails, you should have seen a link to the presenter slides and to the 3 handouts. But once Donnie gets started, I will be posting those links in the chat for those of you that didn't find them there. Additionally, those links will be in the follow-up email that I'll be sending out. So that being said, one other thing, if you live outside of Texas, I do know that people have taken the CEU certificates, have told me they've been able to use them in other states, but I have no way of telling you that. That's really up to the jurisdiction that you're licensed in, so you'll just have to check with them on that. That being said, I want to turn it over to Donnie. This is Donnie Green to talk to us about services for people leaving the nursing home.
Thank you, Marty, and thank you all for joining me this morning. Just a little bit of background on today's topic. I will be talking about services that are available to nursing home residents, but these services are not limited to nursing home residents. So I would say that more than 90% of the content today will be relevant to folks who are working with older individuals or people with disabilities who are in the community, have never had a stay in a nursing home. But one of the reasons I made the topic so narrow is that through our agency and our colleagues throughout the state, there are some specialized services for nursing home residents, and those services tend to be under-recognized and underutilized. So one of the things I'd like to do this morning is make sure that you all are familiar with the Options Counseling Program. And I'm privileged to have Jackie Helmer joining us on the webinar this morning. And Jackie serves as the lead options counselor for the North Central Texas Aging and Disability Resource Center. So I'm delighted that we have folks from other parts of Texas, and there will be quite a bit of information this morning that will be relevant in other parts of Texas. I didn't see that we have folks from outside the state of Texas. If you are joining us from another state, some of the information will cross state lines, but there will be a lot of variability in these services from one state to another. So without further ado, I'd like to talk a little bit about the Texas network. And I will be focusing on area agencies on aging, or AAAs, as well as aging and disability resource centers, or ADRCs. So starting with the AAAs, the area agencies on aging, there are more than 600 AAAs nationwide. In the state of Texas, there are 28. And the services do vary from one AAA service region or area to another. And so as I get into a discussion of the AAA services, I've tried to make a note where services may vary between AAAs. Aging and disability resource centers, like the AAAs, cover the entire state. There are also 28 ADRCs throughout the state of Texas. There are certain services that are available from all ADRCs, and then there are some smaller services that are really unique to the service area. So again, as we get into that portion of the presentation, I'll try to let you all know which services are available statewide, as opposed to those services that may be available only in certain communities. So let me start with AAA services and share some information in terms of eligibility for these services. So unlike most of the programs that are funded by the state of Texas, eligibility is not necessarily on the basis of income and resources. So most of the state-funded programs would be needs-based. The AAA services eligibility is on the basis of age. So in most cases, eligibility will be limited to people who are at least 60 years of age. There are some exceptions to that rule, and we'll take a look at those exceptions in just a little bit. So through the AAAs, we don't turn anyone away because her income is too high or her resources are over certain limits. But with that said, we are required to target certain people who are at risk because of their financial situation, their health status, their social supports or absence thereof. So specifically, through the Older Americans Act, AAAs are asked to target people who have greatest economic need. So typically folks who have low incomes, sometimes below the poverty level, sometimes below 150% of the poverty level. We're also asked to target older people who are frail, those who are isolated, and those who are at risk of premature institutionalization. So at the AAA level, we're asked to kind of develop policies and procedures so that we effectively target these priority populations. And within the AAAs, we may approach that differently. In terms of the cost of services, all of the programs must be provided at no charge to clients. However, we and our service providers can accept voluntary contributions. If folks can't contribute, that's not a problem. If they can contribute but don't want to, that's fine too. And if we do receive contributions, we have to make sure that those contributions go right back to the service under which the contribution is made. So if we have a home delivered meal client who sends us a check for $10, we don't necessarily get to eat steak that day. We just have to use those funds and buy a couple more home delivered meals for that client or for someone else. So I would like to give you a map just showing you what we consider to be the North Central Texas service area. You can see that Tarrant and Dallas counties are shaded in gray. Those are actually two counties that our Area Agency on Aging, or AAA, and Aging and Disability Resource Center, or ADRC, do not serve. However, there are local organizations that would provide AAA and ADRC services in both Tarrant and Dallas County. And again, the rest of the state would be covered by AAAs and ADRCs, but it would be through another organization, either a council of governments, a regional planning organization, a local governmental entity, or a local not-for-profit organization. So again, when I refer to the NCT AAA, I am referring to the services that would be available in these 14 counties that are in white. So there are two different ways that we provide AAA services. One would be directly through our staff, through our volunteers who are working out of our office in Arlington or working out of their homes throughout North Central Texas. And the direct services that we offer through our AAA include benefits counseling, care coordination, caregiver support coordination, long-term care ombudsman. And then we also have a newish program called Pearls, which is a program that provides counseling to older adults who are dealing with depression, persistent sadness, loneliness, or isolation. And you can see that I've put an asterisk after Pearls, and that's to denote that the Pearls program is not necessarily available from other area agencies on aging. Alrighty. And I will talk more about those direct services in just a couple of minutes. Then we also engage local organizations to administer programs at the local level. We don't necessarily hire the staff, supervise the staff, fix the meals, deliver the meals. But again, we rely on those community partners. And the major service that we contract out is nutrition. And actually nutrition consists of two different programs: the congregate meal program, which serves hot meals at senior centers or recreation centers, other venues, and then the home delivered meal program, which by far is our largest program. So of all the funds we receive, about half of those go to support the home delivered meal program. And through our network of providers each year, we fund about 1 million home delivered meals. We also invest in transportation services. You'll note the asterisk. So not necessarily all AAAs would fund transportation, but through our AAA, we fund curb to curb assistance that for trips that are scheduled in advance. In most cases, our transportation would be limited to trips within county boundaries. We do have a small exception to that rule. For the last 2 years or so, we have been funding a pilot program for people who live in Hood and Somervell counties and need to go out of county in order to receive healthcare services. We can also fund people who live in outlying counties and require transportation to Hood or Somervell counties in order to see their doctors. We also support information referral and assistance, which is available statewide. In addition, we also fund instruction and training services. So the program this morning is one of many instruction and training programs that we support. Typically, we work through local partners. So Marty Mascari, who organized this event, who's hosting the event, he is under contract with our organization. He does incredible programs on a variety of topics. We also engage other local partners such as the Alzheimer's Association, which will do workshops, webinars on our behalf. We also invest in a number of education, training, and information services for family caregivers. So Marty also provides those webinars for family members. We've got, I believe, 9 or 10 partner organizations that will do workshops, both live, webinars, on a variety of topics. I've noted just a couple: managing stress, legal issues. Marty's doing programs on what to do when your parent refuses to take her medications, refuses to participate in therapy. And, those are, those are great topics. And I was sharing with Marty, I have lived all of those. So I'm glad I'm not the presenter, because I'm not sure that I handled it just right. But, I really encourage you to get on our distribution list and to help us spread the word for those programs. Other initiatives through our area agency on aging include our Home by Choice nursing home relocation program. This is a program that is available exclusively to people who are living in nursing facilities, and more specifically are receiving Medicaid benefits and are enrolled with managed care organizations. So if we have anybody participating today who's not familiar with relocation services, please hang on to my contact information. We welcome your referrals. Through that program, relocation specialists will work with residents, help them arrange community-based services so that they can make a successful transition. We work hand in glove with the managed care organizations. Typically, those managed care organizations would arrange the Medicaid services, and we as relocation specialists would arrange the non-Medicaid services, the housing, the non-medical transportation. We would help people access transition grants, help them with getting their benefits transferred from facility to community, and so on. Interestingly enough, we currently have a position open for a relocation specialist. So if you know of anyone who would be a good fit for the position, go to our career page on the Council of Governments site, nctcog.org. In addition, our AAA also sponsors a number of preventive health workshops, typically for small groups that will meet over the course of 2 or 3 months. One of the workshops is a series of 8 programs to teach people how to prevent falls, how to overcome the fear of falling, what to do if you have fallen, how to get up safely. We also have chronic disease self-management workshops, which are great for people dealing with any kind of ongoing disease, COPD, heart disease, arthritis, depression, and so on. We've got a more specialized series of workshops to help people deal with diabetes, another to help people deal with chronic pain. And you'll note the asterisk at the top, which means that that these services are not necessarily available statewide. Relocation services would be available statewide. The preventive health workshops, they'll vary quite a bit from one AAA region to another. Alrighty, now I'd like to turn back to some of the direct services I mentioned a few slides ago, and just kind of flesh out those services a little bit, starting with benefits counseling. So benefits counseling provides information, referral, and assistance to people who are at least 60 years old, as well as Medicare beneficiaries. And the benefits counselors help people understand their options for public programs, and their primary expertise is with Medicare, and pretty much all things Medicare. Medicare supplements, Medicare Part D, Medicare Advantage, Medicare Savings programs. But in addition, they have received some training in Medicaid, other health insurance, as well as long-term care options. One of the things that the benefits counselors can do is help people who qualify for Medicare savings programs. These would be Medicare beneficiaries with low incomes, limited resources, and depending on their eligibility, they may be able to hang on to their Medicare Part B premium, or for those with the lowest incomes, they may qualify for not only help with their Part B premium, but also help with their Medicare deductibles and copays. So nationwide, the majority of people who qualify for these programs don't receive the benefits because they don't know that the programs exist, or they would have difficulty with the paperwork. So as a free community service, we're able to assist with that paperwork. In addition, there are also Medicare low-income subsidies, sometimes called LIS, and that is a benefit available to Medicare beneficiaries with low incomes, limited resources, and it would reduce their copays for their prescription medications through their Part D prescription drug program. Now I'd like to talk a little bit about care coordination services. And care coordination services are available through all area agencies on aging, but the services that may be available to clients of the care coordination program can and do vary from one region to another. In addition, the term of service can vary. So through the North Central AAA, we fund these services for up to 5 months. It used to be 3 months, but we have been fortunate to get some additional funds during the last couple of years. And so we have used those funds to extend the maximum term of service. So the services that we've chosen to make available in North Central Texas include light housekeeping, personal assistance services. We can also lease emergency response devices. We can help people with a one-time purchase of prescription medications. We can also pay for medical equipment not covered by insurance. So we buy a lot of elevated toilet seats and transfer benches and shower chairs. If it's somebody who's not eligible for Medicare, or they've purchased equipment under Medicare and it's been damaged, in some cases we can pay for wheelchairs, walkers. We can also help out with accessibility related modifications to the home. So we do a lot of wheelchair ramps, widening of bathroom doorways, installation of grab bars. Although we don't have sufficient budget to remove bathtubs, install a walk-in shower, the state has a maximum that it hasn't increased since before I started here, and I've celebrated my 25th anniversary some time ago. But we can do less expensive workarounds. For example, we have a contractor who's often able to do cutouts in bathtubs. We can also help with utility bills, typically one time only. And then we can also purchase plug-in appliances such as microwaves. We've purchased just freezers. We've purchased window air conditioning units. And I see that there is a question. How many benefits counselors do we have in the area? So in terms of North Central Texas AAA, we have 4 benefits counselors. We also have certified volunteer benefits counselors, and I'm not sure what the most current count is. I believe it's around 10 or 15. Again, benefits counselors will serve the entire state of Texas, but the staffing patterns will be really different. Some of us use volunteers, others do not. All righty. In terms of care coordination, I'd like to share some information about how we determine folks eligible for the service, and keep in mind that we do have discretion at the AAA level to kind of establish our own screening criteria. So what we've chosen to do is come up with 5 different criteria. Currently, in order for us to deem a person qualified and start providing the service, that person would need to meet at least 3 of the screening criteria. So first of all, the person would need to be at least 60 years of age and live in one of the 14 North Central counties. In addition, the person would need to have income at or below 150% of the poverty level, which is around $1,500 a month for a single individual. We also give priority to those who have recent stays in the hospital or a rehabilitation facility or a nursing facility. So I did want you all to be aware of that. Again, this service is not limited to nursing home residents, but nursing home residents actually have priority consideration for these services. We also give priority to folks who are frail, which we define as needing help with 2 or more activities of daily living: bathing, dressing, walking, grooming, toileting, feeding. We also give priority to folks who have a diagnosis of Alzheimer's or significant cognitive impairment, even if there's not an official diagnosis of Alzheimer's or dementia. We also give priority to those who have little or no family support. So again, folks don't have to meet all of these criteria, but in order for us to open up a case, we would look for folks to meet at least 3 of the 5. And as I mentioned, in North Central, we will serve folks up to 5 months through the care coordination program. We have a similar program called Caregiver Support Coordination, and that provides all of the same services that I've discussed through the care coordination program. In addition, it also has a respite care benefit that is available. The eligibility for these services is broader, and this gets a little complicated. There will not be a test at the end. You don't have to memorize this. But, one of the messages that I'd really like to share this morning is that, there's some incredible programs that are available, not only to nursing home residents, but also to people in the community who would qualify primarily on the basis of age. And we really welcome your referrals. And again, if you work in a nursing facility or care for somebody in a nursing facility, just know that that there is priority consideration for many of these services. So in terms of eligibility for the Caregiver Support Program, again, we've come up with a number of screening criteria. We look for caregivers who meet at least 3 of these criteria. They include having poor health or experiencing difficulties at work related to their caregiving. Maybe they're taking too many phone calls, having to take too much time off to get somebody to the doctor, to coordinate with, care providers and so on. We also give priority to those who have, they care for someone who has no other help. They are the one and only source of support for that dependent person. We also give priority to those who care for somebody who's been hospitalized or in a nursing home, in a rehab facility within the last 2 weeks, those who care for somebody with Alzheimer's, other dementias, or impairments of 2 or more activities of daily living. And then we also give priority for those who live in the same house as the care receiver. Again, as you'll note, these criteria are fairly unique to North Central Texas. And in other parts of the state, although the service would be available there may be a different approach to determining eligibility, and there may be slightly different services that would be authorized through those caregiver programs. So in terms of eligibility for the caregiver programs, the caregiver would need to be at least 55 years old if caring for a relative under the age of 60 who has severe disabilities. So we would have authority to serve a 57-year-old woman who is caring for her 35-year-old daughter with cerebral palsy, if that resulted in a severe disability. Similarly, we can serve people who are at least 55 years old if they are a grandparent or relative other than parent of a child under the age of 18. So again, we could serve a 57-year-old woman who has primary custody of her 10-year-old and 15-year-old grandchildren. Again, the exception there is we would not be able to assist a 55-year-old parent of a minor child. We can assist a caregiver of any age if they're caring for somebody who's at least 60 years old, and we can assist a caregiver of any age if caring for somebody who has Alzheimer's disease or a related disorder. So again, that's a lot of information, but again, just give us a call. We'll be happy to screen, determine if somebody may qualify for these caregiver services. Some of the services we can pay for through our caregiver support program include respite vouchers for childcare, for summer camp. We can also pay for legal assistance in some cases. Typically, we would be paying for an attorney to help establish guardianship. We don't sue people. We don't get involved in, criminal. Typically, we would just be limited to what I consider permanency planning issues. We can also provide limited financial help with back to school clothes, supplies. We can also provide benefits counseling to that caregiver as well as the care receiver. Alrighty, I've talked a little bit about some of the caregiver support services, but I wanted to mention a couple of others. And we do work with partner organizations, the Alzheimer's Association, the Wellness Center of Collin County, other organizations, and through those organizations, we do a lot of educational workshops, support groups, Alzheimer's, as well as the Wellness Center will do support groups. Alzheimer's typically for caregivers of people with dementia. At the Wellness Center, they'll do support groups for caregivers in general, regardless of what health condition that care receiver may be dealing with. We also support small group education and support, and then through the Wellness Center of Collin County, we also pay for individual counseling for family caregivers as well. All of those services are unique to the North Central Texas Area Agency on Aging. I'd like to talk just a little bit about some new directions, and the program I'd really like to highlight is Dementia Friendly North Central and East Texas. So this is a program that we're just getting ready to launch, and through this program, we'll be rolling out some new services. We'll also be partnering with local organizations. And our goal here is to develop a comprehensive array of services for people with dementia family caregivers. We will be working with partners in both Dallas and Tarrant County. And specifically, what we'll be doing is providing in-home services for people with dementia and family caregivers. We have hired a case manager who is a certified dementia educator, has been working with people with dementia for a long time. She's also bilingual. So one of the things that we're doing is conducting new outreach to people who speak Spanish. We're also supporting a program called REACH, which is provided through the Alzheimer's Association. Parkland Hospital is developing capacity to offer REACH. This will also be available in East Texas through the Alzheimer's Alliance of Smith County. And the REACH program provides ongoing personalized education and support for family caregivers. So a dementia educator will work with that family over the course of several months, help them understand what's going on with the disease and help them troubleshoot behaviors that are challenging, whether it's wandering, not wanting to take a bath, asking the same question again and again. In addition, we'll be working with the James L. West Center, and it will be doing a lot of classes on our behalf, dealing with dementia, which is a 4-hour workshop for family members. They'll be doing the Dementia Live program for family caregivers. And if you guys are not familiar with the program, it is a really powerful simulation that gives you a small window into the world of a person with dementia. Another thing that the James L. West Center will be doing is training for partner organizations. So if you've heard of Dementia Live and you work with an agency and you would be interested in becoming a trainer and offering that program for your staff, other people in the community, I think there will be some opportunities there. James L. West will also do the Compassionate Touch training, which is intended for family members, and it teaches them strategies to use touch in order to address difficult behaviors. That the power of touch can be really impactful, and particularly in dealing with somebody who's becoming agitated, sometimes just the right touch can help in kind of redirecting and calming someone down. Through this program, we and our partners will also be doing a lot of dementia training for professionals as well. And one of the things that we'll be focusing on is training to help professionals and family members recognize possible dementia among people with intellectual and developmental disabilities, and particularly Down syndrome. So people with Downs tend to experience accelerated aging, and they may start developing signs and symptoms of dementia as early as their 40s and 50s. Here's the contact information for our Area Agency on Aging, 1-800-272-3921. As Marty indicated, you will get a copy of this PowerPoint presentation. So I've given you my email address. We have a fax number for our Area Agency on Aging, and then I've provided you the mailing address as well. Alrighty, so now I want to turn to our Aging and Disability Resource Center, or ADRC, and this is a program that helps people of all ages, all types of disabilities, and their family caregivers. And the purpose is to help people find, get connected to long-term services and supports, such as attendance services, home health, respite care, minor home repairs for safety, and so on. So this is a service that is available statewide. And when the ADRCs were funded by the state maybe 10, 15 years ago, initially, the only service that the ADRC provided was that information and referral. So we didn't get any funds to buy services, pay for attendant care or repairs or transportation. But over the years, we have gotten a little bit of funding, and little is really the operative word. And the exciting thing is that there are some direct services that are available through all of the ADRCs. One of those direct services is Respite Care, and that provides a short-term break to family members who aren't receiving respite care, can't afford to pay privately. It may be structured a little differently in other parts of the state. In North Central Texas, it's easy to qualify. That's the good news. The bad news is it's a pretty limited benefit. So typically, folks who receive our respite benefit would receive several $100s one time only. Through North Central, they receive vouchers that they can use to pay somebody to give them a break. They can use the vouchers in the home, at an assisted living facility, at an adult day facility, and so on. Housing navigation, Marty, who is our host for today's event, is actually our housing navigator as well. So he wears several hats. That's a program that is administrative in nature. The purpose is to inventory affordable housing. Marty has come up with a wonderful inventory that's located at nctadrc.org/housing. You can sort by county. You can look at, he's got a tab for retirement facilities. In addition, Marty and the other housing navigators will work with housing developers, and the goal is really to expand the availability of affordable housing. And I tell you, that's a heavy lift. The demand for affordable housing is so much greater than the available resources. And I'll tell you that our requests for immediate affordable housing are some of the most difficult we try to respond to. People usually end up really mad at us after we tell them that, typically the wait is, 2 years, 3 years, and it's almost impossible to go to the top of the list. In addition, North Central and the other ADRCs can provide assistance with Medicaid applications. We actually have a short-term project where we've engaged somebody who will do the paperwork for Medicaid benefits, for SNAP, even for the free cell phones that are available to folks who are receiving public benefits. So options counseling, this is the program that I really, really want to emphasize. This is the service that's provided primarily by Jackie, who's on the line. Again, this is a statewide service. So if you work with folks in nursing homes, please know that through the ADRC, there is a program that will help your residents without Medicaid to identify and access community-based services. And again, just a quick reminder, if you work with nursing home residents who have Medicaid, there are relocation services available through the managed care organizations and relocation specialists. So nursing facilities, we've got you covered. We cover the waterfront. Relocation for Medicaid, options counseling for non-Medicaid. So what the options counselors do is they'll engage in a more in-depth conversation, sometimes talking with family members. And what Jackie does is she will screen folks to see if they may qualify for any federal, state, local services. So kind of one of the go-to programs would be the Hhsc Community Attendance Services, or CAS. That's a great program for folks with low incomes who aren't receiving Medicaid benefits. And I would say that we probably make referrals to that program very frequently. We probably make more referrals for our AAA services than CAS, but they're probably tied neck and neck. So I've talked a little bit about AAA services. I've shared a lot of slides with eligibility criteria, probably making your head spin. So again, the good news is you don't have to remember all that. Just remember that here we are. And if you want to save Jackie's contact information, she'll probably be your new best friend. We can also kind of do a quick screen to see if people may qualify for the VA Aid and Attendance Program. Again, kind of my experience is that it's underutilized. And then if people don't qualify for our AAA caregiver services, We will also see if we can get them qualified for our ADRC respite program. Through our AAA, those services are limited to age-eligible people. Through the ADRC, we don't have any age restrictions. So we would be able to provide respite care to a middle-aged dad who's caring for a minor child with special needs. A brand new special initiative for us is we recently hired a staff person, Raul Duran, and he is available to help people of all ages throughout our service area locating and accessing the COVID vaccine. So if folks are homebound, not a problem. He can help schedule the vaccination in home. Our agency can also arrange and pay for rides to vaccination sites if transportation is a barrier. Here is the contact information for the Aging and Disability Resource Centers. This is a statewide number, so this is not specific to North Central Texas. And if you call, it will ask you for your zip code, and then it will route the call to the appropriate Aging and Disability Resource Center. We are available Mondays through Fridays from 8 o'clock until 5 o'clock. And again, you'll be getting a copy of this presentation. Since I wanted to highlight the Options Counseling Program, I actually provided Jackie's email address. The ADRC has a dedicated fax line. I've given you that fax number as well. Our mailing address is the same, other than it's to the ADRC rather than the AAA. And alrighty, so it looks like we have just a few minutes. And Marty, did you want us to see if there are any questions, or did
there are several questions,
okay,
several comments in the chat, and I know there's something in the Q&A.
Okay, well, tell you what, Marty, I know that everybody is likely interested in CEUs. So do you want to just review the CEU information one more time?
Perfect.
And then I'll be happy to stay on the line and respond to questions as long as necessary.
That's perfect. That would be great. For those of you that are on to acquire CEUs, we are licensed or set up for the state of Texas for licensed social workers and licensed professional counselors. I know many of you are on different webinars of ours, and just so you know, each webinar, all of our webinars have different CEU providers. In some cases, our partners provide the CEUs, and some of them are set up to provide nursing CEUs and that type of thing. So it varies by webinar, but we are set up to do for licensed social workers and licensed professional counselors. We also will provide a certificate of attendance if you need that. For today's session, it's for 1 hour, classroom hour of CEUs. You must have completed the entire live webinar. You can't miss more than about 5, maybe 10 minutes at the most of the webinar in order to qualify. And we have to substantiate that with the records we get from Zoom. And then there's a certification for you to make as you're filling out the Google survey. You also must complete the Google survey. It should pop up on your computer as you close out today. If it doesn't, I know there's companies and some of you have blocks that block those pop-ups. You will also receive that in the follow-up email. That follow-up email will also include Donnie's slides and the handouts she just mentioned, and that will go out later today. You'll have a week to complete the survey. And then we'll get the CEUs and the certificate of attendance out within the 7 days following that. So look for that. If you don't get it by the 20th, feel free to reach out to me, but please give me till the 20th to get them out. That would be great. So Donnie, I don't know if you want to advance to the final slide, if you would, and we're going to talk about our next upcoming webinar that we have on our schedule, real quick, trauma-informed care. The presenters will be the James L. West Center that Donnie referred to earlier in her presentation. So Donnie, I'm going to put it to you to answer any questions that you'd like to answer that are in the chat or the Q&A.
Okay, I'm going to start with the, and I'm going to stop sharing my screen. Pause the share, alrighty. Let me start with the Q&A. If I refer someone to the AAA, will they make a referral to the ADRC if it is determined that they could receive benefits there? Do I need to request that they call both agencies? So speaking for North Central only, we are all in the same office, and I think we do a really good job of making referrals to each other. One phone call should be sufficient, and it really doesn't matter whether you call the AAA or the ADRC first. Now, in other parts of the state, there may be two different organizations that administer the AAA and the ADRC services, so they may not necessarily have the same kinds of referral protocols in place. You know, I would say it's never harmful to you know, to try somebody else and see if there's a resource. You know, one of the reasons why our jobs are so difficult is there are a lot of people who need things that aren't readily available, and we all kind of have our special knowledge areas. And you know, we would not be offended if you called two of us and asked the same question. Because again, we may have some information that the others are not aware of. All right, how does a local small business become a partner with the AAA and the ADRC? So in the old days, we actually had what we called memoranda of understanding. We no longer do that. So we welcome anyone and everyone to be a partner. So, you know, we welcome referrals. We've gotten referrals from Burger King, from Brookshire's. We love that. A lot of times those local businesses are looking to us to make referrals, and that's more difficult. So, you know, we don't maintain short lists of, you know, people we like best in terms of home health. So we wouldn't be able to make a referral to a specific home health to the exclusion of, you know, the other 500 that are in the area. So again, that relationship would not allow us to give favoritism in terms of referrals that we may make out. But again, we welcome the opportunity to partner with local businesses in order to be a resource for employees and customers. All righty, so let me turn to chat, and let me back up to.
I think the first one is that we've had several people referred to home by choice programs, and they were unable to secure provider services at home due to a lack of workforce. Are you seeing this in the larger area?
Yes, I have not found the solution, but yes, this is a huge pain point. And what's happened is it's always been difficult to staff those positions because the pay is so low. Typically, there are no benefits. The work can be physically demanding, can be isolating. And then during the pandemic, you've seen that, you know, fast food retail, they've had to increase their wages in order to get adequate workforce. Those are the businesses that are competing with the provider agencies. And it's sad. The starting salary for an attendant who's funded through the Medicaid program is, I believe it's $8.11. And again, keep in mind that there are no benefits. In the early days of the pandemic, they had to purchase their own equipment. We, through our area agency on aging, can go much higher. You know, we don't participate in Medicaid. We're not limited to the $8. And I tell you, even if we're able to pay $20, $30 an hour, we're having difficulty getting an adequate supply of providers. So, you know, unfortunately, there's no easy fix other than us being willing to pay for what the work is worth, which is a whole lot more than $8.11. You know, there are potential solutions in terms of, you know, Texas had the option of enhancing its attendant wages and it declined, which breaks my heart. You know, I read an article the other day saying that, you know, that we need to allow more immigrants visas to do this work because a lot of people who are born here don't want to. Well, if there are other qualified people who will do it, maybe that's a solution. So again, very real problem. One of the workarounds, and this isn't a magic bullet, is there are ways that the consumer can choose his or her own attendant. And so sometimes the person is able to identify a family member or a friend of a friend. And there are ways that the managed care organizations can pay that person through the consumer directed service option. One of the things that we've been advocating for is to allow spouses to be paid providers. A lot of times they're willing to do that, but the state of Texas won't allow that either. So, and I'm sorry, I could go on for days, and I know that we've got other questions here. Alrighty.
Does the relocation work with people moving out of nursing homes that are moving out of state?
It can. It's much more complicated, and there's not as much assistance that we can provide. So we do the best we can. The problem is the managed care organizations, or we can't authorize Medicaid services in other states. And even on the relocation side, we can't. There's a little bit we can do. We may be able to pay for a transition grant, but you know, we wouldn't have control over those local agencies. So yes, but again, the assistance would be very limited in most cases.
Mike was interested in, I think it's Michael, was interested in, I think that's right. I can't see the name, but interested in partnering with you on the home modification and home equipment recommendations, and would like your tub cutout contact if you could share that.
Sure. Yeah. Just shoot an email to me at dgreen@nctcog.org.
What about patients with other forms of dementia besides, you talked about Alzheimer's?
Yeah, it's not limited. It's not limited to Alzheimer's. And again, through Dementia Friendly, we're not even limiting to people with a diagnosis. It's sad, only about half of people with dementia are diagnosed. Of those half who are diagnosed, half aren't even notified. So we don't want to be too restrictive.
Somebody asked, and I don't know what the context was where you were within your presentation, but it was, what about someone 91 and legally blind?
So yes, that person would potentially be eligible for the full range of AAA services, other than, you know, the dementia if there's no diagnosis of dementia. But yeah, typically the care coordination, caregiver support coordination, they'll serve people with all types of conditions. Not limited to dementia, not limited to nursing home residents, cancer, you know, arthritis, depression, you know, low vision, hard of hearing. There really are no restrictions in terms of diagnoses when it comes to AAA services. Same thing with caregiver services. We work with the waterfront of caregivers. It's just we have a few programs that really specialize in dementia care.
The Antoinette asked, how do you make a referral? And I know you included some forms in your stuff, but go ahead.
Yeah, so we have an open referral system. We accept referrals by phone, 1-800-272-3921. We accept emailed referrals, and we accept faxed referrals. We'll take a referral on the back of a napkin. We just need to know who to contact. So Tarrant and Dallas do receive AAA and ADRC services. They're through different host organizations, and the services are just a little bit different. Tarrant County, it would be the United Way of Tarrant County that would offer the AAA services. It would be Tarrant County MHMR that would offer the ADRC services. Dallas, it would be Community Council of Greater Dallas that offers the AAA services. It would be MetroCare that would offer the ADRC services. Okay.
What happens after 5 months? You had talked about you've extended the care coordination services.
Yeah. So the state actually has a limitation of 6 months, and so occasionally we can go a little bit beyond the 5-month period, but our practice is to close the case typically after 5 months, certainly after less than 6 months. In some cases, we will serve the client again, but typically we will serve only once during a fiscal year. While we're serving that client, we're working to put into place ongoing services if we can. So we're making referrals to Hhsc for community attendance services. We're working with family. So the ideal would be that once our services end, they would be able to transition into some other subsidized services. But the reality is a lot of times we're serving them because they don't qualify for anything else. And so we're talking with them, just letting them know, hey, the best we can, we need to figure out what's going to happen when we close our case in 5 months. Sometimes it's a smooth transition. Sometimes it's, oh my gosh, but I still need this. How can you do this? Well, I'm sorry, but we've been talking about it every month. We'll be doing this through April 6th. Just a reminder, we'll be doing this through April 6th.
There's a question about NCT's services in helping someone who's moving into a nursing facility for just a few months, but has to move out of their apartment while they're in the nursing home.
And I'm not aware that we've gotten involved in those types of situations. I wouldn't rule that out. The one thing I would offer, if this is somebody who is, who would receive Medicaid benefits, there is a Medicaid policy that allows nursing home residents with short stays, typically 6 months or shorter, to actually divert a portion of their income to pay for the cost of that community residence. And that's a policy that's not widely known. So again, if it's a Medicaid beneficiary, there's a pretty easy to access resource for somebody who doesn't have Medicaid. If that person is being funded by Medicare, they would be able to keep their check. They would be able to support that community residence. If it's somebody who, is paying privately, there may be a way we can help, but that would be new activity for us. And so we just have to make sure that the state would allow us to provide that assistance and that our budget could bear it. There have been situations where we've paid emergency rent, but typically it's been 1 month only or up to X $100. And if you're talking about 3 months rent and the average apartment is $1,500 a month, we would not have sufficient resources to cut a check for $4,500 for rent. Definitely patients with other types of dementia, and like I said, even those without a diagnosis. Wow, a voice from the past. Hi, Beverly. Yes, it has been 30 years. Again, just give us a call, 1-800-272-3921.
I want to answer the question. We are recording this. We do record all of them. You will get a first email with the slides, and the link to the evaluation. There will be a second email that will go out, a follow-up email that will go out in about a week that will have a link to the recording via YouTube of today's presentation.
Very good. And again, if you're not sure which one to call, just call one of them. If we're doing our job, we'll get you connected with the other. And no, so DHS will allow family members in some cases, but they prohibit spouses. And that's where we're advocating to allow spouses to be considered. And it's up to the discretion of the case manager. Sometimes they say yes, sometimes say no. Alrighty, I think that's most of the questions.
Someone asked where to get educated about family caregiver for Medicaid.
Yeah, so through the ADRC, we take a lot of those questions. I would say refer to the ADRC for that issue in particular.
Very good. Well, Donnie, thank you very, very much. Great information. Thank you. Thanks, Jackie, for joining us. And thank you all for joining us today. If you have any questions, you're more than welcome to email me and I can pass them on to Donnie or Jackie, or you can email them on the information I gave you on the slides. We look forward to seeing you on Tuesday for trauma-informed care. And thanks again for joining us. Thanks, Donnie.
Thank you.
Have a great day.